Let's talk about antidepressant medications. First, let me start by saying that you must only take these meds under the supervision of a physician who is experienced in mental health conditions. Most often, that is a psychiatrist. Psychiatrists specialize in giving medications as well as providing some therapies. Psychologists are experts at the different types of therapies. Antidepressant medications are used for treating depression, some forms of anxiety. Sometimes they're even used for relieving pain, and also they can be used to help control some addictions. There are many different types of antidepressants, but the commonality between all of them is that they help control our neurotransmitters, serotonin or norepinephrine, also known as noradrenaline, or dopamine. Neurotransmitters are like messengers in our bodies and in our brain. Their job is to carry chemical signals or messages from one neuron or nerve cell to another. Serotonin is the neurotransmitter that controls mood. Norepinephrine is the neurotransmitter that focuses on our executive functions, how we think about and understand our experiences. It has a lot to do with our motivations and how we deal with stress. Dopamine is the neurotransmitter that allows us to feel pleasure. Since most of what we strive for in life is pleasure, dopamine plays a huge role in determining our motivations and our mood. These three neurotransmitters together, they regulate our feelings, and the antidepressants affect the levels of these neurotransmitters. And also they affect how we absorb them in our brain. Some antidepressants are called SSRIs. That stands for selective serotonin reuptake inhibitors. These meds help keep serotonin available in the synapse for a longer period, so our nerve cells absorb more serotonin. Other antidepressants work in other ways, but they all help balance the chemicals in our brain so that we feel better and sleep better and even concentrate better. Sometimes when we feel depressed, we aren't motivated to use therapy tools or even to talk to anyone about our depression. Antidepressant medications can help within 2 to 3 weeks, and they can make even the most depressed individual see some light at the end of the tunnel, enough to motivate them to try some therapy tools in a regular and consistent way.